Hi, Charles Bradley here. Welcome to Facebook Live. This is Frank. He's my grand dog. How you doing, Frank? He's a senior dog, and we want to talk about senior dogs today. So here's Frank. Have a little biscuit, Frank. Oh my gosh, Frank. Sit. Sit, Frank. No, he's not going to listen. And that's part of the thing that I wanted to talk to you about today. Frank is losing his mental capacity. He's suffering from cognitive dysfunction syndrome. And there's a lot of other changes I wanted to tell you about with Frank. So Frank is acting a little confused, and he's quite agitated as a general rule now. And this is something that I see quite commonly with older dogs. I'll just get back into frame here. And senior dogs are very, very often quite anxious. So that's one of the things I wanted to talk to you about today, was anxiety in the older dogs and some of the other things that you want to look for in senior dogs. So let's talk about the anxiety. So they can have brain aging just like us. And I want to talk about some of the supplements that we like. We really like BD. So when I look down at Frank and he's looking back at me, it's really clear that the B/D prescription diet really helps him. And that has antioxidants and certain things that will help brain function. There's other supplements that can be given. Even something as simple as this, which is a fatty acid supplement, we really like this one. It's called the Freeform SNP Tips. Very bioavailable and calculated for a dog dose. So EPA and DHA. So moving on, another use of this fatty acid supplement, when combined with a glucosamine supplement, just the one we like, Daisequin, answers another common ailment of both dogs and people, of course, is joint trouble, joint inflammation. When I get up and I am creaky, I remember, oh, I forgot to take my Daisequin. Just kidding. No, I don't take Daisequin. I take Cosamin ASU. And I'll tell my hockey buddies about it because it does help me, and I think it could help your dog as well. So joint issues, anxiety issues, these are big with senior dogs. And if you're seeing those changes, I think you should discuss it with your veterinarian. We do a lot on that side. We're trying to be more friendly to the older dogs and be aware of their special needs. Now, another common question that I will ask is your dog getting through the night? Can he get through the night without urinating? The nighttime pee-pee issue can be a big thing, and that is a common finding in older dogs. Increased drinking, increased urination. So if you're seeing a lot of thirst, that's a big issue, and that definitely needs to be addressed. The way that we address that is we'll do screening blood work, we'll do a chemistry profile. We usually combine that with a complete blood count, which checks the red cells, white cells, and platelets. And we will do very often a thyroid, and we certainly want to do a urine analysis. Because as dogs age, their kidneys can age, and they can lose the ability to both clear out poisons out of the body, and they can also have problems with saving of water. So that's why sometimes they drink more. And if you've ever noticed a very dilute, clear-looking urine coming out, that often means that the patient can no longer save water. So probably to finish up, the joint problems. Can your dog still do stairs, up and down stairs? That's a good measure. Does your dog have tentativeness when going downstairs? That could mean that the elbows and the joints are very creaky. And as I look at Frank down here, I know that he has very creaky joints. His elbows are very sore, his neck and his spine are sore. And you need to have special attention. That gets us back to these supplements that we talked about, the Freeform and the Daisequin. This in combination can be very helpful for joint issues. And as dogs age, we have to be concerned about their liver and their kidney function. So many of the medications that we use for joint issues require testing. So really when a dog gets to that super senior age that Frank is at now, they become special needs patients in that they have to come more often to the veterinary hospital. They have to have more testing, and they can do very, very well. They are really different in their needs at that time, and my only message to you is if you have a senior dog and you're seeing any of the changes that we've talked about, let your veterinarian know. So let's just recap and finish up with what we want you to think about. So, is your dog drinking more water? Is your dog urinating more? Can he get through the night? Can he do stairs? Is he jumping up and down? Is he confused? For example, when you open the door, is he lining up on the inside of the door or the door that swings, the edge that swings? So get into that mindset. Remember that BD dog food can help if your dog is starting to have early dementia issues. And that's basically it. If you have any questions, you can